Asthma is the most common chronic disorder of childhood, affecting 6.8 million children and accounting for 12.8 million lost school days per year. Annual healthcare costs related to asthma are estimated at $19.7 million. Lung disease and other breathing problems are among the leading cause of death in babies under a year old. As many as 20% of children discharged from academic medical centers are dependent on some kind of health-sustaining technology.
African American children are 4 times more likely to be hospitalized from asthma and 3 times more likely to die from asthma compared to Caucasians. Similar disparities are found in many health conditions, even when socioeconomic status and disease severity are controlled for. Healthcare leaders must have the skills to identify the many causes of this problem and intervene at the various levels.
The University of Florida Pediatric Pulmonary Center trains future leaders in the culturally competent, family-centered, interdisciplinary care of children with chronic respiratory conditions. PPC trainees are graduate or postgraduate students in pediatrics, social work, nursing, nutrition, and respiratory care. Trainees learn to care for the respiratory needs of medically fragile children. They are also taught to advocate for these children in the community and at the state and national levels.
I'm doing actually an asthma research. Mainly why I got interested in that is because children most likely end up in the hospital because of asthma. That is the most common reason for children to end up in the hospital or the emergency room.
From a very young age, I was able to see how children were suffering, and it just seemed to me so strange that you know, I was okay and they were suffering. And I think for the rest of my life, that's really just been my direction, especially career-wise. And I've always wanted to do something to help children, especially those with special needs from diverse backgrounds and those who came from impoverished areas.
Personally, I took an interest in it because I grew up with asthma. So I can understand how hard it is to have respiratory difficulties from time to time.
Ralph told me that if I need anything, just call him. And he was just one of the best. When I say one of the best, he was one of the best.
It was real interesting because I think in the medical field, a lot of times people in general don't see a lot of African Americans, especially male African Americans, providing services. So I think that was a shock to a few people, but I think it was a benefit to a lot, because I think a lot of the young men who we saw, especially those Hispanic and African American, they could identify with me a little more because I was, you know, somebody they kind of saw themselves as looking like, I guess you could say.
What I've really enjoyed so far about the PPC is the opportunity to work as part of the interdisciplinary team. I think it gives a very unique perspective on treating patients as a whole patient rather than just addressing only the socioeconomic issues that are going on or only their medical issues, but rather seeing how all of those things really impact the patient health.
We have core curriculum classes that are focused on leadership and are taught by a variety of the members of the faculty, and they are directed toward meeting the students' needs in gaining a wider perspective about the populations of patients that we take care of and the various systems that we work within, and also about the diseases that we take care of in pediatric pulmonary.
Well, one of the things we ask our students to do is complete a leadership portfolio during their traineeship. And so it helps them focus on their leadership activities, but also allows them to have some outcomes of what they've done.
About 2 years ago, the PPC decided to get serious about family-centered care. So they employed family partners to advise them on being family-centered. And part of that initiative involves education of students and professionals, but also fostering a sense of partnership within the patients and their families themselves.
Well, I've really enjoyed the variety of experiences I've been able to have here at the PPC. There's been an element of learning some additional case management skills, clinical skills, advocacy, outreach to community groups, grant writing, all sorts of different things, which has been a great learning opportunity thus far.
Immediately after graduation and finishing at the PPC, I stepped into my first job as a nurse practitioner, which was my dream job, doing the primary care for high-tech home care kids. And so immediately I was using my pulmonary things I had learned, because all these children were at home with feeding tubes and ventilators and colds and all kinds of diagnoses. It's not just a pulmonary group of children, it's just a group that are all medically complex, and so the majority of them have pulmonary issues, or even if they didn't have pulmonary issues, they'd get a cold and then it would be a pulmonary issue. So I used my things I learned at pulmonary all the time.
Former PPC trainees move on to hold leadership positions around the country. In addition to directing cystic fibrosis, asthma, and sleep programs, former trainees provide outreach to underserved areas, conduct and publish research, educate healthcare providers, and advocate for health equity. Most chair professional committees, and many have won awards for their achievements. Former trainees of all disciplines affirm that it was from their PPC experience that they gained the confidence and the competence to pursue these activities.